Hi, my name is Casey Sisko, and this is my second speech, the demonstrative speech for the public speaking course. This is my audience today, which consists of 11 different people. Okay. The topic of my speech today is how to take a pulse. According to the American Heart Association, 326,000 out-of-hospital sudden cardiac arrests occur annually, with 88% of those occurring at home and not in a hospital situation. Unfortunately, 70% of people feel helpless to act in the event of a cardiac emergency. It is essential to know how to take the pulse of another individual if they are experiencing a medical emergency. I have been a registered diagnostic cardiac sonographer for the past 6 years and have worked in a hospital setting during that time. I have been involved in many different emergency situations. I also am a pacemaker recipient and have been for the past year. My life was saved previously by somebody knowing how to take a pulse. If you are involved in a medical emergency outside of a hospital setting, it is essential to know how to take the pulse of another individual. I know firsthand how important it is to do so, and today I will demonstrate how to do that. I will begin by explaining how important it is to know how to take a pulse. Failure to act in a cardiac emergency could result in an unnecessary death. Unfortunately, many cardiac arrests occur at home and not in a hospital setting. If you know how to take the pulse of another individual, it could essentially save their life. Once it is established whether or not another individual has a pulse, CPR can be administered. According to the American Heart Association, acting in an emergency can only help. If you see an unresponsive adult who is not breathing or not breathing normally, it is important to call 911 and then press hard and fast in the center of the chest. It is important to keep in mind, however, that there are many different factors that can influence another person's heart rate. These factors can include their activity level, their fitness level, the air temperature, their body positioning, whether they are sitting, lying down, or standing, the person's emotions, the person's body size, and whether or not they are taking any medications. Now that you know how important it is to know how to take a pulse, I will demonstrate how to do so. Dr. Lukowski describes a technique that is very easy to understand. It is fairly simple to take a pulse of another individual. I will demonstrate this with two main actions. I would now like to ask for a volunteer to come up and let me demonstrate this. Mother? No, stop. Stand right here. I will demonstrate this today on two different areas. The first main action in finding a pulse is to find it. The first place I will demonstrate this is the carotid artery. In order to find the pulse of the carotid artery, you will place your index and middle finger to the side of the windpipe. You will then begin to feel a palpable sensation. The second place that I would like to demonstrate this is the radial artery, and this is located in the wrist. Once again, you place your middle and index finger over top of the tendon and the bone in the radial artery. The radial artery is on the thumb side. You will then begin to feel a palpable sensation. The second major action in doing a pulse is to count the number of palpable sensations for 15 seconds. You then times that number by 4. So 21 times 4 is 84. So my mother's heart rate is 84 beats per minute. You can sit down now, yes. The number that you calculate is the person's pulse. See how easy it was to calculate? A normal heart rate is between 60 to 100 beats per minute. Anything less than 60 beats per minute is considered bradycardia, and anything over 100 beats per minute is considered tachycardia. If you are unable to find a pulse, that is considered asystole, and that is when CPR would be administered. Today I have shown you how easy it is to obtain the pulse of another individual by using 2 different techniques. If you are involved in a medical emergency outside of a hospital setting, it is essential to know how to take the pulse of another individual. Knowing how to take another person's pulse could save their life and prevent an unnecessary death. Thank you.
Thank you.